Role of caregiving work.
Again?
Role of caregiving work.
Role of caregiving work. That is not the principle.
違うんですか？なんだ。
Principle or philosophy. Okay. If you are asked what is a Japanese caregiving all about, then I explain. One, caregiving that maintains dignity. Two, supporting independence. Three, what is that? Okay. じゃあ、
忘れました。
シェラさん、please help him.
Arranging living environment.
Very good. Arranging living environment. Arranging living environment. Because unlike other profession, caregiver is like a companion of the user, right? Caregiver can stay with the user. So a caregiver is the one who arrange living environment comfortably. And also, we should remove all risk factor to provide the safe condition or environment. Okay, arranging living environment. These three principles is very important. Okay, then I told you that the two important words when you study about the Japanese style of caregiving. One is dignity. Okay, dignity always comes first. Then second, independence. Okay, independence. Yeah, how about the regarding the professional ethics? Professional ethics. Professional ethics mean so caregiver must do or must not do. Okay, I told you the 4 points of professional ethics of caregivers. Okay, じゃあゆかさん、can you tell us the one of the professional ethics of caregiving? Caregiver?
Keeping the privacy of the
Good.
patient.
Good. Privacy. So respect for privacy. Okay, respect for privacy because we do the excretion care or bathing care. Don't let user embarrassed. Okay. Okay. じゃあ second、セシルさん、マリアさん。
Confidentiality obligation.
Very good. Confidentiality obligation. Confidentiality obligation. Maintaining of confidentiality. Good. Don't post the picture with user without any consent from the user. Okay, じゃあ third one, アラさん。
Prohibition of physical restraints.
Okay, physical restraint. Good. Prohibition of the physical restraint. Okay. So, because everybody has human right. Human right. Okay. We should respect the user's human right. But sometimes we have to do the physical restraint, right? Sometimes. Not sometimes. There are the three exceptions. We have to do the physical restraint. Alan-san, can you tell us the three exceptions? Alan-san?
I'm sorry, sir. Exception.
Exception. So we have to, we shouldn't do the physical restraint except Okay, Era-san, can you help him?
Hi. Impending.
Impending.
No other means.
No other means.
And temporary.
Temporary. Good. Good. In principle, we shouldn't do, must not do physical restraint except these three. Impending, no other means, temporary. Okay? And then the last one of the professional ethics. ジュディさん。
すみません、忘れました。
忘れました。OK。じゃあ、アンジェラさん。
normalization は入ってますか？
Normalization is a part of the dignity だね。Normalization. Maintain of normalization also important.
なんかその何々 abuse
何々 abuse. Yes. Yeah. The prohibition of abuse. So prevention of abuse. Yes, yes. You're right.
あ、そうです
Abuse.
か。
Abuse. Don't do the the abuse. あれアンジェルさん、you have a kid? Are you single?
え
Do you have
?No, いや、シングルです。
あ、シングルですか？あ、そうですか。Okay. So abuse not only for the older people, but also the kids. Okay. Mother or father shouldn't do the abuse. Okay. Okay. There are 5 type of abuse. 5 type of abuse. じゃあ、アルドニーさん。Tell us the 5 type of abuse.
Is it physical, mental,
Physical abuse, mental abuse.
service? なんか忘れましたね。
忘れました。じゃあ、ゆかさん。Physical, mental.
Physical abuse, mental abuse,
うん。
economical abuse,
Again?
financial abuse,
Financial abuse, financial abuse. Okay.
sexual
abuse. Yes. Physical, mental, financial, the sexual. Last one. Last one. Okay. じゃあ、セシルさん。Last one.
Neglect, abandonment.
Yes. Neglect, abandon. Okay. Like don't give the food or just leave the older people alone. Okay. The abandon the responsibility to take care of the user. That is a neglect. Okay, good. じゃあ、let's move on to today's topics. Okay, let me share the slide. はい。Okay. Everybody can see?
はい。
はい。Okay. We start from the care service. Okay, care service. There are the 3 parts of this subject. So Japan has long-term care insurance system. Long-term care insurance system. The special insurance for caregiving. Okay, unlike the national health insurance, it's a different long-term care insurance. Okay, the purpose of long-term care insurance, you can see. Okay, the long-term care insurance system support the independence. See, that is an important word, independence of the elderly by establishing a community that guarantee people a secure life. That is the purpose of long-term care insurance. Long-term care insurance was established in the 2000. So Japan already have a 20 years experience of the long-term care insurance. Okay, then there are the 2 topics, how to use long-term care insurance, and then classification of health condition. First, how to use, like this. Okay. So if you or the family member need long-term care insurance, you visit the city hall or local municipality to apply for the long-term care insurance. Okay? And then after that, investigator will visit your house to judge or to interview what is the physical or mental condition and circumstance of family structure. Then after that, there are initial screening and secondary screening conducted by certification committee composed of several specialists like a nurse or care manager or dentist or what else? The public health nurse. So they discussed the classification. I mean the level of health condition. And then user will receive notification of result from evaluation for long-term care service. After that, care manager will make care plan. Okay, care plan. Then based on that care plan, user will receive the care service from long-term care insurance. This is the procedure, okay? So this is a brochure of the Tokyo Metropolitan brochure of long-term care insurance. So if you are 65 above, you can apply for the long-term care insurance, or 40 to 64 also apply for long-term care insurance. But the applicant should have these 16 category of disease, like a cancer or dementia, something like this. Then people can apply. So this is from the brochure. The field survey is that the investigator will visit your house to check. And then initial or secondary screening. Then the certification committee is the one who certification committee discuss about the classification of the health condition. Okay. Then there are the three categories of classification. Or if, okay, first category is the non-applicable, which means that you are healthy enough, no need to use long-term care insurance. Okay, but still you can use free activity for health development conducted by local committee. In the Philippines, like the barangay or barangay captain is the one who organizes this kind of the preventive activity. So is there this kind of the activity in the Philippines? Era-san?
I'm sorry.
Yes. So in Japan, local committee provide this kind of the free activity for the older people. Is there similar service in the Philippines? In the barangay?
I have no idea.
No idea, because you are not that old. I understand. How about Ara-san? Is there any similar service?
I think so. In our barangay, they provide Zumba. 知ってますか?
Zumba ね。
program
Yes.
for
Zumba
old
program.
people.
そう、じゃあ、old people in the committee will join the Zumba program? Good. Yes, actually I joined the Zumba program. So I saw the many old people. Yes, the same as that kind of the service, the Zumba, or sometimes the local committee, community provide the education, how to prevent or how to prevent dementia or how to train your body. Okay, this is the free activity. And then second category is needed support. Needed support, level 1 and level 2. So if you are qualified for the needed support, you can receive the preventive care service. Preventive care service. Okay? And then last one is needed long-term care. Needed long-term care. Level 1 to level 5. Level 1 is lightest. Then level 5 is severe, most severe. Okay? The more the if you are qualified for level 5 long-term care, you receive the most volume, most amount of the service. Okay? But level 1 is a less amount of service coverage. Okay? Then there are 3 types of the service: home visiting care service and daycare service. Last one is facility care service. Okay, for the foreign caregiver with SSW can work only for facility service, not home visiting service. Okay. Then the next is the types of care service. Again, home visiting care service, daycare service, and then facility care service. I told you that there are the 3 types of the facility care service, right? In Japan. Let me ask. 3 types of the facility. How about アルドリンさん？
私、はい。
はい。
はい。
So, can you tell us the one of the type of the facility care service?
Home service?
Home service. Home service.
Home care?
I'm talking about the facility care service. There are 3 types of the facility care service. じゃあ、OK。じゃあ、J さん。3。はい。J さん。はい、アランさん。アランさん。
はい。Is
はい。
that the Tokyo and the Roken?
Oh, very good. So, Tokuyo and Roken. Good. Good. Tokuyo is a special nursing home. Roken is a health service facility for the elderly requiring care. Good. Very good. The last one.
Kai go Ryoin.
Very good. 介護医療院。そうです。合ってます。Care-based medical facility. 介護医療院。Very good. Okay. So these are the belonging to the facility care service. Okay. Thank you, Alan-san. So then, largely we can divide the 3 big categories. Okay. Home care service. It's composed of home health service and then day service. Because day service, user commute from the house to daycare center, right? So that's why the daycare service is belonging to home care service. And then the Alan-san already explained facility care service. Then community-oriented service, that is a new category. Community-oriented service. This one, community-oriented service. can you guess with this name? Can you guess what kind of the service you can receive from the community-oriented service? Cecil san, do you have any idea? What do you come up with by seeing this name, community-oriented service?
I'm sorry, I already forgot.
No, because I didn't teach you.
Okay.
I just asked what do you come up with seeing this word, community-oriented service?
Regarding about the something regarding about
Regarding about
ano ba yung personal?
Personal?
No. I'm sorry.
It's okay, it's okay. So, because I didn't teach you, just I asked. How about Judy-san?
Okay.
What kind of service you can come up with?
I think it's for the elderly to be oriented around its surroundings.
Surrounding. Yeah, surrounding. So, can you give me the specific service? What kind of service? Yeah, just guess. No idea?
No idea.
Okay, じゃあ、シェラニーさん
はい。
But you are a nurse and then working in the hospital, right? In Japan.
はい。
はい。What do you think? Sound familiar? Community-oriented service?
No, sir.
No, okay. So, what do you think?
But if I will just base on the name and
based on the name,
describe it, it's like in the Philippines we do community health teaching.
Like, health teaching.
はい。
Okay,
はい。それかな。
Yeah. Yes, good. Yes, one of the service from the community-oriented service is yes, you're right. Kind of the education service, education, health education. Okay, good, thank you. アラさん So, okay. Now you are young, very young, okay?
はい。
But if you become, let's say, 17 years old, okay?
はい。
And also, you are suffering from dementia, okay? Then, where do you want to live? Where do you want to live? Where do you want to be cared? Which place?
Well, some place that I'm familiar with, which is at my home.
Oh,
with my family.
With your family and in your community. Why do you think so?
Because that is where I'm familiar and I feel comfortable.
I see. Where is your the place you feel comfortable?
At home.
Home. Where is your home? Where the home that you are living now?
With my family.
Where?
Makati.
Makati?
Yes.
Makati is your the place that you feel comfortable.
Yes.
Makati. Okay, good. How about Angela-san? Same question. Where do you want to be cared if you are suffering from severe Alzheimer's dementia? And also
そうですね。I think I'll go for home also, together with my family.
Where is your home?
In Cavite.
Cavite. I see. Yes. Yeah, I agree. But for me, I want to live in the province in the Philippines rather
そう
than
ですね。
rather than my I grew up in Tokyo, but Tokyo is very busy. I love the province in the Philippines. But anyway, so most of the people want to live continuously the community where people are familiar, right? Especially when you get older. That is the concept of community-oriented service. Community-oriented service. So the community help all of the residents in the community to let them live in the house and then in the same community as long as possible. Then community integrate all of the necessary care service, like this: regular visiting and on-call visiting care service, and also the visiting care service at night. Okay, home visiting busing service, and also home visiting nursing, rehabilitation, and healthcare guidance for in-home care. Okay, even though you stay in the house, you can receive the care service which can provide it in the facility. That is the concept of the community-oriented service. You don't need to move to the other community, which is not so familiar. Okay? But I think some of you want to live in Japan, right? Who want to live in Japan when you get older and then receive the care service? Shira-san, you want to live in Japan?
No.
No.
I want to live in Japan, but when I get older, I want to go back here in
Go
the
back to the
Philippines.
Philippines.
はい。
そう。じゃあ、Jay さん when you get older, you want to live in Japan? Because you can receive the this kind of the long-term care insurance. I think much advanced than I think the Philippines.
I think I will still choose Philippines.
Still Philippines.
Hi.
Okay, understand. Okay, and nobody want to live in Japan when you get older. How about Yuka-san? Philippines, Japan.
I want to live in Japan when I get older.
Oh, so Japan is more familiar for you?
Not that I'm familiar in Japan, but I think that I get the most of the let's say medical services.
Yes.
Yes.
Yes, you're right. Okay, so some people prefer Japan, but the most of you want to live in Japan, right? No, Philippines, right? Especially get older. Okay. So the next is the care service. No, care service, care process. Okay, care process. So after receiving the care service, every year a user have to renew because the health condition always change, right? Always change. So we should check the care service is still applicable, appropriate for the user or not. So we do the assessment and then discuss about the care plan with other specialists and then implement them, do implementation. Then after that evaluation, check the service. So we continuously proceed the care process. Okay, the next chapter is safety maintenance and risk management in caregiving. Okay, first, observation. Observation is one of the most important tasks for caregivers because, as I told you, caregiver is a profession who is the closest to user. Okay, so that's why the caregiver observe very carefully, then recognize small difference or subtle the symptom, then share what you observed with other profession. Because other profession cannot see the whole picture of user's lifestyle. They can see only part of user's life, right? Then based on the observation that caregiver shared, like a physical therapist adjust the training, okay? And also the dietitian can see how much amount of food user eat, and then they can dietitian can arrange form of meal. So all of the information came from caregiver's observation. That's why the observation is very, very important. Okay, this is the procedure how to observe and how to use the observation from the user, from the caregiver. Observe user carefully first, and then write on care journal and share it with other staff. As a result, improved users' quality of life. And then this is a proper way of observation. Observe the user without any virus. And then ask family member if you need background of user or the health condition or family structure. You should ask the family member. Then if you find any symptom, you should consult doctor or nurse. Okay? This is the proper way of observation. The next is the body mechanics and prevention of lower back pain. This is the point of body mechanics. Body mechanics. Okay, let me share the video first regarding body mechanics. Okay.
ボディメカニクスとは、人間の体の動きに力学の原理を応用して、より小さな力で、より安全、効率的に介助を行うための技術です。支持基底面を広げる。人体や物体が地面に接している部分を、支持基底面と言います。支持基底面が広いほど倒れにくくなります。重心を低くする。物体の重さの釣り合いが取れる点のことを、重心と言います。立っている時の人体の重心は、おへその下あたりにあります。重心が低い位置にあると倒れにくくなります。実験してみましょう。支持基底面を広げます。重心を低くします。引っ張られても踏ん張ることができます。重心をもっと低くすると、より安定します。重心を近づける。何かを抱えるときは、重心を近づけます。肩関節からの距離が近いほど、小さな力で持ち上げられます。重心を近づけると力が伝わりやすくなり、安定性が増します。また、重心が近いほど重さを感じなくなります。大きな筋群を使う。小さな筋肉は早く疲れてしまうので、大きな筋肉を使います。太ももの筋肉は、体の中で最も大きな筋肉です。腕の力だけではなく、膝を伸ばして持ち上げます。複数の筋肉を使って、一つの筋肉に負担がかかるのを防ぎましょう。水平に動かす。持ち上げる動作は重力に逆らっているため、大きな力が必要です。膝の屈伸を利用して、なるべく水平に動かしましょう。水平に動かすことで、重力の影響を受けにくくなります。体をひねらない。体をひねると不安定な姿勢になり、腰にも負担がかかります。足先を移動した 置面積と言います。設置面積が小さくなるほど、かかる摩擦は小さくなります。摩擦が減るので、介護に必要な力も小さくすることができます。てこの原理を使う。力をかける箇所を力点、力を受ける箇所を作用点と言います。両者を支える箇所を支点と言います。腰を支点にして上半身を起こします。てこの原理で力が増幅するので、小さな力で解除できます。
はい、OK. This is the point of the body mechanics. Body mechanics is very important because to prevent the lower back pain. Okay, let me review. First point is lower the center of gravity. Lower the center of gravity. And then expand the stance. Expand the stance. Okay, expand the base of support. Base of support. Then make the user smaller to reduce the friction. Okay, make user body smaller. Number 4, use bigger muscle like a thigh or abdominal muscle or low back muscle. Then pull horizontally rather than push or raising vertically. Pull horizontally. Okay, and then don't twist your body. Don't twist the body to put more burden on your lower back pain. Instead of twisting the body, put the toe toward the direction of movement to avoid twisting the body. And then be closer to a user when you do the transferring care. Be closer to a user. Okay, the last one is use principle of lever. Use the principle of lever. These are the point of body mechanics. Okay, so body mechanics, I can say the 100% on the exam. 100%. Please review and also watch the video again. The next is prevention of lower back pain. Lower back pain. Okay, so we ensure safety for the user, but also we should protect ourselves. If you are not healthy, how come you can give the better caregiving service to the user? Okay, so prevention of lower back pain is very important. Then how to prevent? First, use user's remaining ability and function. Okay, and use medical assistive equipment. There are so many useful assistive devices. You should make use of these assistive devices. Then use body mechanics that I already explained. Then review your lifestyle. Don't eat too much. Do the exercise. Check your lifestyle. Okay? エラさん、Do you do exercise?
Occasionally.
Occasionally.
But not every day.
Occasionally. How often do you do?
Maybe once a week.
Once a week. Once a week. So if you work as a caregiver, you should do more exercise. Okay?
はい、わかりました。
はい。じゃあ、let me ask. アルドリンさん How
はい
often do you do the exercise?
Elsa 先生と同じ。
あ
一回ですね、1週間。
once a week.
はい。
Once a week. OK, じゃあ、how often, how many times do you eat per day?
I eat a lot.
You eat a lot. You eat a lot.
Yes.
So please review your lifestyle.
はい。
So actually for me, I do exercise almost every day in the morning. I went to the gym. Yeah, today also I went to the gym 6 o'clock, do the exercise, and then only one time I eat only dinner, not to gain the weight. This is my lifestyle. Okay, so for the caregiver, be healthy. So that's why the review your lifestyle is important. Okay, the next is infection and countermeasure. Okay, there are 6 parts. First, what is the infection? Infection is an invasion and multiplication of pathogens into body and then causes various disease and symptoms. Type of pathogen is virus, bacteria, fungus, and parasite. Then principle of infection countermeasures. Infection control measures. Okay, first, remove infection source. Second, shut out infection route. Third, improve healing power to resist by resting well and then taking nutrition enough. There are 3 factors of infection disease. Host means organization, the person who has the pathogen or bacteria or something, host. Okay. Then source of infection, root of infection. There are 3 factors connect each other. Then countermeasure is to cut off each link, cut off. So that's why the remove infection source or shut out infection route. Then improve the healing power of the host. Then this is the basics of the infection control. Don't bring in, don't bring out, don't spread. That is the principle. Okay. Then again, the observation is very important. So when you work in the nursing home and then you see the symptom of the user, like fever or vomit or diarrhea, this kind of the symptom, you should report it medical staff. So to prevent infection disease as early as possible, don't bring in the infection in the nursing home, and then don't spread. That's why the observation is very important. You should recognize small symptom or subtle difference from the usual. You should report it to medical staff. Then type of infection route: droplet infection, airborne infection, and contagious infection. Okay. Shira-san.
Hi.
So for the coronavirus, coronavirus is belonging to which one? Which type of the infection routes?
Droplet infection.
Droplet infection. Good. Yes. Corona is said to be the droplet infection and also contagious infection. But some reports, some resources say corona is also airborne infection. So which means that we don't know yet. We don't know yet coronavirus. Okay, then type of infection source is blood bodily fluid, and excrement, like bodily waste or vomiting. Okay. Then prevention of infection. So have you heard standard precaution? Standard precaution? Standard precaution are set of infection control practice. Okay. Let me share the video about standard precaution. Please watch.
Standard precautions, formerly known as universal precautions, are very important to apply when performing those tasks in which a worker may be exposed to blood, body fluids, or tissues. When at risk, always take the following specific protective measures. First, perform aseptic hand washing. Put on personal protective equipment dependent on the procedure. In most procedures, gowns and gloves are most frequently used. The gown should be put on first. Then, if required, put on eye protection and a mask or a face shield. Finally, put on gloves. Assist with the treatment or procedure as your office policy dictates. Follow OSHA procedures to clean and decontaminate the treatment area. Place reusable instruments in appropriate containers for sanitizing, disinfecting, and sterilizing as appropriate. Remove your gloves and all personal protective equipment in the reverse order that you put them on. Gloves first. Place them in waste containers or laundry receptacles according to OSHA guidelines. Complete these protective measures by washing your hands.
Okay, so put it simple to explain the standard precaution. It's in the nursing home. So we consider all of the user as a person who already affected. So that's why we avoid touching without the glove. And when you communicate, we put on the mask or gown. Okay, don't spread the infectious disease. That is a concept of the standard precaution. Okay, and then how to put on the mask. That one also was on the exam before. Cover from nose to chin. Nose to chin, like Cecil-san. Cecil-san, you cover the nose? Yeah, good. Or Aldrin-san. So you are very good. So nose to chin. Okay. And then how to remove the change a disposable glove. Remove the glove inside out. And then dirty side should be inside. Don't touch the surface of the glove. Inside out. Then discard the glove into the designated place. Only specific garbage box. Rather than throw away the many garbage box. Only designated place. And then change the glove every action. Even though the glove is still clean, you should change every action. Okay? Then washing hand is most important. Washing hand. How to wash the hand properly. Everybody knows how to wash? You know how to wash properly? Alan-san, you know how to wash properly? You do hand washing every day, right? Alan-san?
Yes, hi.
You know how to wash properly?
What is from I don't know.
Okay, so you should know because that one will be on the exam. Okay, I'm gonna share the special video how to wash the hand. Okay, please watch. Hold on a second, please. Okay, so actually the picotaro's way is recognized by the WHO. So that is the way how to watch to follow the picotaro. Okay, the last one is this. Accident prevention. Okay, accident prevention. So always observation is very important to prevent the accident. Okay, and then check if the clothes and then shoes are appropriate, especially the slip. Okay, because user or all the people is vulnerable to falling easily. So you should check the shoes. And then when user or when you operate the assistive device, you should check first. Check the brake or check the air, tire air, okay, pressure. Then the one of the philosophy of the Japanese way of caregiving is arranging living environment. Okay, for the purpose of the risk management, you should remove risk factor. Okay, then like this, you see the picture of the vacuuming, right? That was on the exam before. When you use the vacuum, the cord should be bundled up, not for user to fall. Cord bundled up. Okay. Then this is the picture of the accident triangle. It shows the relationship between the serious accident and minor accident. Okay. Have you heard the Hiari hat? Hiari hat is a near-miss report. Near-miss report. If there are 300 the near-miss accident. Near-miss accident meaning accident doesn't happen yet, but almost happen. That is a near-miss accident. If there are 300 near-miss accident, 29 are minor injury accident and 1 serious major injury accident. So if you reduce the number of near-miss accidents, relatively reduce minor or major accident. So that's why the caregiver should report when you encounter near-miss accident. You report. Then share it with all of the staff to reduce or prevent major accident. Okay? This is the way, okay? The user almost fell from the bed when he transferred from the bed to the wheelchair. The caregiver encountered near-miss accident. Then you should think why it happened. Then you share what you think and then you report with other profession or other staff to prevent future accident. Okay, the last one is this. Disaster preparedness measures. In Japan, earthquake happened a lot. So we should prepare the necessary supplies. We should prepare the survival kits. And also we do the, periodically we do the emergency drill to know how to escape. Okay? Disaster preparedness measures also important for risk management. Hi. Okay. Then, all right, all of you complete the chapter, category of basics of caregiving. Okay, basics of caregiving. Then you're gonna take the confirmation test after this. And the next category, which is mechanism of mind and body. So that one, you don't have this kind of the Zoom lesson. You should watch the video carefully and then read the textbook, then do the confirmation test. Okay? Do you have any question? Aran-san, you know the how to wash? Like Picotaro. Okay? Follow the Picotaro. I can say that how to wash is 100% on the exam. How to wash properly. Okay? はい。じゃあ、千野さん何かありますか？
はい。じゃあ、ズームクラスが終わりましたら、ちょっと5分ほどトイレ休憩を挟んで、それから単語テストをまず初めにやって、次に確認テストをやります。確認テストはですね、今、考えている35分ぐらいを考えてるんですね。一番初めですので。こちらで皆さんの解くスピードですとかをちょっと見ながら、